Simba is a 9-year-old Persian cat, a female intact cat, who presented to us with a mammary mass. It started off about a month and a half ago, where it was involved only one mammary gland, and then it went on to basically spreading to other mammary glands as well. We did a fine needle aspirate, which got diagnosed as a carcinoma. I would really like to talk a little bit about mammary tumors in cats. This is a very aggressive tumor type in cats. It is similar to what is called as triple negative in women. So it's a highly metastatic cancer. It is a very aggressive tumor, and if we don't treat this aggressively, we lose our patients within 9 months of diagnosis. So hence, it is a preventable cancer if these cats are spayed before their first heat. And because these tend to be so aggressive, we highly recommend spaying cats before the first heat, because after spaying them after a couple of heats lose the protective value of spaying them. So if you want to have the protective value of not getting mammary cancer in cats, spay them before the first heat, because afterwards it does not have any protective value. In Simba's case, this was obviously an aggressive cancer. There are 4 mammary glands, pairs of mammary glands in cats. Typically, how we want to approach these is see that it's not spread anywhere else in the body. So we did chest x-rays and an abdominal sonography for Simba. There's no evidence of spread there. And then go ahead with a procedure called as a chain mastectomy. So while we remove the actual tumor, we also want to remove all the other normal mammary glands as well. And this is to prevent new masses from forming. Because this is such an aggressive tumor, this has shown to be actually prognostic, which means if we are aggressive with our surgery the first time around, the cats can live longer than if we are not aggressive. In Simba's case, we actually did a bilateral chain mastectomy under the same surgery, which means we removed both the chains of all the mammary glands and removed all the lymph nodes. So we removed both the inguinal lymph nodes, which are near the groin, and the axillary lymph nodes, which are near the armpits. Unfortunately, the tumor had already spread to the inguinal lymph nodes. So she's recovered well post-surgery, doing well, eating, drinking okay, no complications for the surgery. But because it's already spread to the lymph node, and knowing that this is such an aggressive cancer, we are following up with chemotherapy, chest x-rays and abdominal sonography, because in spite of chemotherapy, this can still spread to other parts of the body. The goal of chemotherapy is to prolong the time frame from diagnosis to spreading to other parts of the body. So let's see how Simba does. So far she's doing really well.